I'm Dr. Mary Jo Fiddler, and I'm a lung cancer oncologist at Rush University Medical Center. Thank you for joining our virtual celebration of Lung Cancer Awareness Month. 2020 has been a tough year for many reasons. However, it has actually been a great year for the treatment of lung cancer. Just in 2020, we had 8 new FDA-approved treatment regimens that we can now offer our patients. We still have a lot of work to do, but patients are living longer, and that is great news. I remain optimistic about our future together. We hope that we can celebrate in person next year for Lung Cancer Awareness Month at our annual Shine the Light celebration. Thank you for listening.
Hi, I'm Michael Liptay. I'm the chairman of cardiothoracic and vascular surgery here at Rush and the co-director in our lung cancer program. November is Lung Cancer Awareness Month, and our Shine the Light event is one of the highlights of our year. It's always energizing and humbling to reconnect with patients that have been successfully treated and are getting on with their lives in such a courageous fashion. I am going to miss that in person this year, but hopefully next year we'll be able to restart this in person. That being said, minimally invasive surgery for early stage lung cancer continues to be the bedrock of our treatment plan, and those that can undergo this are able to get rapidly back to their lives and recover quickly because of the small incisions and the short surgery. Early detection with lung cancer screening allows us to find more early cancers that we're hopefully able to cure. And please don't forget to continue your screening efforts if you're at risk and meet the criteria, and to see your physician on a regular basis still during this tough time in COVID.
Welcome to Shine a Light. My name is Linda Dowling. I'm the Lung Cancer Screening Program Manager here at Rush. My work is focused solely on early detection. Lung cancer screening is a low-dose, non-invasive CT of the chest that has been proven by research to find lung cancers at an early stage when they are more treatable. My hope is for those of you who are viewing and listening, for you to learn about this life-saving exam by speaking with your physician. Thank you.
Hi, I'm Phil Benomi. I'm a thoracic medical oncologist here at Rush University Medical Center, and I've worked here for over 40 years trying to help and treat lung cancer patients. I'm going to share a few thoughts today about the major progress which has been made with immunotherapy in the treatment of lung cancer. It's a very exciting area, and it's one that for many years we were very disappointed because it didn't work. The various things we tried didn't work. But the scientists stuck with this, and they eventually found what we call immune checkpoints, which are kind of, you think of it as a rheostat. If it's turned down, it's preventing the lymphocytes, the good cells, from killing the cancer. Here's a cancer cell, here's a lymphocyte trying to kill it. But there's a protein on the surface of the cancer cell. If it locks horns with a protein on the lymphocyte, it shuts it down. This white blood cell that's trying to kill it shuts it down. But if we give these treatments, these antibodies that are given as an intravenous infusion, they block the protein on the surface of the cancer cell. Now the good cell, the immune cell, can get to it and kill it. And what we've seen is patients, even with far advanced lung cancer, which we've always said can't be cured with the therapies we had, we're now seeing people out 5, 6, 7 years after being treated with these. They're off treatment. They're still in remission. We believe that many of them are actually going to be cured. They're already long-term survivors based on the usual treatments we could use. So we think they can be cured. We've also seen improvement if we use the same immunotherapy after radiation and chemo for the treatment of tumors that are locally advanced. They're still in the chest, but they're too far advanced to be operated on. So they get treated with radiation and chemo, given simultaneously, a treatment that was pioneered at Rush. More recently, studies have shown if you do immunotherapy after chemo and radiation, there is an improved survival, and we're participating in some trials to try to even improve upon those initial results and locally advanced. We also have participated in several trials looking at immunotherapy in the earliest stage cancer patients who were treated with surgery. All the cancer was removed. There's a chance it can come back. Immunotherapy, we hope, is going to reduce that. So these are very exciting times. in the treatment of lung cancer and give a lot of hope to patients with lung cancer and their families. Again, sorry we can't meet together this year, but I'm looking forward to meeting with you next year. All of us are on the Rush team in the Brennan Pavilion when we can meet in person and we can celebrate the successes that we're seeing in the treatment of lung cancer.
Hi, I'm Dr. Gaurav Sharma, radiation oncologist at Rush, and I specialize in lung cancer. One of the very exciting aspects to what I get to do day in and day out is offer a very highly focused, highly precise, and highly effective form of radiation. And using this technology has been very game-changing for our patients in terms of both ability to control cancer as well as optimize quality of life. In fact, sometimes we're able to treat patients with just a single shot of this highly focused radiation, and that can be very effective and cause virtually no side effects. In the spirit of all the advancements we're making on the drug side of things, chemotherapies, immune therapies, targeted agents, this highly focused form of radiation pairs very well with some of these systemic therapies as well. And so we're learning new combinations and sequences of putting these therapies together, and we're noticing that we're not only able to extend quantity of life for patients, but certainly optimize patients' quality of life as well. We're very honored and humbled that you are all taking time to experience Shine a Light virtually this year, and we're so sorry that we can't be doing it in person, but hopefully we'll be able to reconnect in person next year.
My name is Dirk Lauber, and I am a chaplain with supportive oncology in the Cancer Center. When we shine a light on lung cancer, what gets illuminated may find itself in a hopeless place. It can be enormously difficult to live with cancer, and even more so to have lost someone to it. Bringing to light the burden of this disease may feel like too much to bear, yet it is in the darkest of places where light is most needed, since it also sheds light on clinicians and researchers who are working to bring comfort and even eradicate lung cancer completely. So blessed are you who bear the light in unbearable times. It shines brightest in the simple love shown through an encouraging hug or an act of service. May we turn our faces to this light and let it fill us with a stubborn hope that will overcome every obstacle. May it be so.